Welcome back to this edition of Wealth on Health. As technology advances in our ever-changing world, so do the treatments available for deadly diseases like Parkinson's. Enter deep brain stimulation, a major advance in doctors' ability to improve the condition of Parkinson's patients. We sat down with Dr. Dee Silver, a neurologist and movement disorder specialist at Scripps Memorial Hospital La Jolla, to find out more about DBS as well as other treatments being used to fight the shaking palsy. Deep brain stimulation has been a significant breakthrough for the treatment of Parkinson's disease, and Dr. Silver can definitely attest to the wonders that DBS has done.
Deep brain stimulation has been a major advance, and the reason is because once the patient is optimized in their pharmacological therapy, that means they've got a good, robust response to L-DOPA, they're doing well, you got the medicines as best you can, then DBS will really help these patients. It will reduce their dosage of L-DOPA about 55%. It will improve on time, which is where the drug wears off. It will reduce dyskinesias, help tremor. It's very beneficial. In fact, today I saw 3 patients that have had DBS just within the last 2 weeks, and they are doing great.
The immediate effects of DBS can be life-changing for a Parkinson's patient.
At one point during the surgery, they turned the Activa on, and the tremors completely stopped. My jaw loosened, and I hadn't realized that my jaw, was doing that, and it was just amazing.
The major symptoms I had was rigidity, so I couldn't. If you're watching my hands at that time, this is about as good as I could go with my hands. Since the Activa DBS, I've been able to now button my own buttons, tie my own shoes, tie my ties. I can write better than I could before.
However, not every patient is excited at the prospect of this procedure.
As a rule, I don't like people drilling my head, so I'm not real big on that. But if it comes to, that's what Dr. Silver says to do, I would consider it.
Let's meet one of Dr. Silver's patients, Richard Williams. At a recent checkup, we saw firsthand the admiration Dr. Silver has for Richard's progression with the disease.
Richard is one of the patients who has really been very beneficial for his disease. He's gotten good pharmacological therapy. He has gotten good general health therapy and care. He's done really well.
Richard was diagnosed 13 years ago, but believes he may have had Parkinson's for a much longer period.
August 5th, 1996. So about 13 years ago, but I can look back another 12 years and think of symptoms that I had. I think I've had it for about 25 years. I was taking a shower once, and I was just going real slow, and I said, if I didn't know better, I think I had a stroke or something, because I was just slow.
Despite his long battle, Richard has a very positive outlook on life.
Well, it's a lot better than having some of the other things, like cancer, and when I come up here, if I'm feeling sorry for myself, all I have to do is see a little kid with taking chemo or something, and it kind of brings back, things come back to you, and say, it's not that bad,
In addition to treatments like DBS and levodopa, new trial drugs are being developed to counteract the symptoms of Parkinson's.
I was on a trial drug, and I'm in transition because the FDA hasn't approved the next lot of tests, but I did well on that. There's no name. I think it's like M70 or something like that, but they don't tell you any name. But I did a Comtan trial when I first came in here.
Now, a new drug has come out called Azilect or Rasagiline, and that is a drug that is an MAO type B inhibitor, does a good job. We use that early, and there is some very early evidence now that it may delay the progression of the disease. So that's a new important finding today, and people are excited about it.
Still to come on Wealth on Health, for those who thought there was no hope, see the impact stem cells are having in this Parkinson's fight.
In early or moderate stages of Parkinson's disease. And so I worked on her, for her with this method, and when I saw her 6 months after, she was like another person, you know.